Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Vitamin C is very important for the proper function of your immune system. Now, the largest hospital system in New York State is the Northwell Hospital group. It's comprised of 23 member hospitals. And a recent article in the New York Post, a local newspaper, reported on seriously sick coronavirus patients, COVID-19 patients, being admitted to the hospital. They were given large doses of vitamin C by infusion. It was injected directly into their veins. Now, Dr. Andrew Weber, he's a pulmonologist and critical care specialist. He's exactly the kind of doctor you'd want to see if you had COVID-19 and it got out of control. He's affiliated with 2 Northwell Health facilities out in Long Island. He said his intensive care patients with the coronavirus immediately received 1,500 milligrams of vitamin C by intravenous infusion. And then they gave an identical amount 3 or 4 times a day until they were getting better. Now, he based his regimen on experimental treatments administered to people with the coronavirus in Shanghai, China. Now, Weber said, Dr. Weber, the patients who received vitamin C did significantly better than those who did not get vitamin C. It helps a tremendous amount, but it's not highlighted because it's not a sexy drug. So a spokesman for Northwell, now that's 23 hospitals, that includes Lenox Hill Hospital in Manhattan's Upper East Side. The spokesman said vitamin C was being used widely as a coronavirus treatment throughout the system, but they noted that the medication protocols varied from patient to patient. It depended on what the clinician decided. Now, Dr. Weber said vitamin C levels drop dramatically in patients with coronavirus when it's causing real problems. Let me explain what the real problems would be, because we're going to go forward with this. And I'll tell you why vitamin C is important in a little while also. The COVID-19 virus can trigger a severe inflammatory reaction in the body. It's kind of like a whiplash reaction from your immune system. And the immune system releases massive amounts of interleukin-6, a very powerful cytokine that can cause severe inflammation if too much of it is expressed. So they call it cytokine storm. And what happens, there's a coronavirus specific type of pneumonia that they could pick up on x-rays, and this triggers acute respiratory distress syndrome, where the lining of the lungs fill up with fluid and it's hard for you to breathe. And the interleukin-6 is intimately involved with that, and it can actually destroy your lungs. I mean, it could destroy the heart, the lungs, the kidneys. It's very damaging in the brain. So vitamin C helps dampen and tamp down the level of interleukin-6, so you're less likely to have that cytokine storm that's so dangerous in the latter stages of the coronavirus infection. And it also restores the release of interferons. Interferons are mediators in the immune system that triggered the production of more immune cells to kill a virus. So welcome to an important update, vitamin C and COVID-19. Now, vitamin C is essential for fighting infections. Vitamin C is a crucial vitamin. It's necessary for the correct functioning of your immune system. It has effects on the immune system that help eradicate viruses, which I will explain shortly. Now, vitamin C is what I consider to be adjunctive for fighting the infection. In other words, it's an add-on to whatever the doctor's prescribing, just like I would consider vitamin D and zinc to be adjunctive, but they're extremely important adjunctive therapies. So, hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. Here's a study on vitamin C and people in intensive care units. Now, this is not coronavirus. This is other infections. It's in the journal Nutrients. It's the University of Helsinki and the University of Sydney. And they gave people in intensive care units 2,000 milligrams of vitamin C a day, like 1,000 milligrams twice a day. That's what I would do. I would split up the dosage because it lasts longer in the bloodstream. They gave them vitamin C twice a day, and it was getting them out of the hospital a lot quicker. This is according to a meta-analysis of a number of human clinical trials, 12 human clinical trials. So what happens when you're admitted to the hospital with an infection, your vitamin C levels drop like crazy because the immune system is soaking it up, and I'll explain why in a sec. They found recently in COVID-19 patients in intensive care units, they couldn't even detect vitamin C in their blood plasma. Plasma is the clear fluid in your blood. That's where they would look for vitamin C. And when they looked at the plasma, the vitamin C was so low they couldn't even detect it with their equipment. Vitamin C is needed to get immune cells from point A to point B. So for instance, the first responders are called neutrophils. They're a type of white blood cell. And if you get enough neutrophils at the site of an infection, it basically wipes it out. It just tears it apart. But the neutrophils may not necessarily be at the site where you're developing the infection. They have to be mobilized and get there. They have to be transported. They usually travel through the lymphatic system. So maybe they're in your lymphatic gland under your underarm. Somebody sneezes on you with the flu, and now the neutrophil has to get to your nose or mouth to kill the flu before it becomes dangerous, before it becomes set. And if you get enough neutrophils at the site of an infection fast enough, it could pretty much prevent the infection, depending on the type of infection. Vitamin C is needed for that. It's called chemotaxis. For the neutrophil white blood cell, the dominant white blood cell in the first phase of the immune system wiping out and attacking a virus, it's called chemotaxis. Vitamin C is needed for that. And then once the white blood cell gets to the site of the infection, whether it's your eye, your nose, your big toe, wherever it is, then it has to release its arsenal of weapons to kill the virus. That's called respiratory burst. That also requires vitamin C. So your local immune cells soak up the vitamin C like crazy at the start of an infection to get there and then to kill the virus. Now, normally the government recommends 70, 80, 90 milligrams of vitamin C a day for people. You have to get vitamin C every day. It's water soluble, so you lose it every day in your urine. It doesn't stick around. You need 70, 80, 90 milligrams a day, but why? To survive. That's for survival. That's to prevent scurvy. Scurvy is due to a lack of vitamin C, so you can't make collagen and connective tissue, and basically you fall apart. Your connective tissue, your joints, your cartilage, your ligaments, your tendons, your skin, your hair, your nails, everything's falling off. It's seriously dangerous. So the 70 milligram or 80 milligram of vitamin C in the diet is meant to prevent scurvy. It's not the best level. If you have to fight an infection, you need a lot more than that. Now, vitamin C is also needed for the extremely powerful, more educated part of the immune system called the adaptive immune system. It's needed for the lymphocytes, the T cells, the B cells that have our antibodies, and the natural killer cells. So for you to create more of these lymphocytes once you have an infection, you need more of them than normal, and for them to function, they require vitamin C. Now, researchers report in studies that vitamin C has activity against influenza, the herpes virus, poliovirus, Venezuelan equine encephalitis, human lymphotropic virus type 1, which is HTLV1, and HIV, immunodeficiency virus, but also parvovirus and rabies virus, plus others. So it has antiviral activities. Now, recently there was an article in BMJ Nutrition, British Medical Journal Nutrition, Prevention and Health, outlining the need for a bundle of supplements when you're fighting viruses such as the coronavirus. A review in 2017 concluded that 3 controlled trials found that vitamin C prevented pneumonia It prevented pneumonia. And 2 control trials observed a treatment benefit of vitamin C for patients with pneumonia. And of course, coronavirus gets dangerous when it triggers pneumonia. That's not the only time it becomes dangerous, but that is a common time when it becomes dangerous. An earlier Cochrane review, undertaken in 2013, collated evidence from 3 prophylactic trials. It found a statistically significant 80% or greater reduction in pneumonia incidence in vitamin C groups. Giving people vitamin C reduces their risk of developing pneumonia, and of course COVID-19 triggers pneumonia. Now, vitamin C has beneficial immunomodulating properties in patients with viral infections. So it helps the immune system work, and it helps protect you from onslaughts of an overactive immune system, which is when the coronavirus gets dangerous, it's due to an overactive immune system. So besides having a direct impact on immune cells, vitamin C helps combat infections and the damage they can cause in a number of ways. It's anti-inflammatory for cytokine storm, so it's an anti-inflammatory antioxidant. It's an antioxidant that helps protect your immune cells while they're doing their job. It's also a weak antithrombotic, meaning it has a tiny ability to help prevent a blood clot during an infection. Now, vitamin C could hold some promise as a preventative agent against COVID-19. I'm going to go into studies in just a minute. But it definitely plays a role in preventing the critical phase of COVID-19. You know, when the lungs are getting attacked, or the heart's getting attacked, or the kidneys, or the lining of the intestines, or the brain. It's also necessary for helping to treat or prevent acute respiratory distress syndrome. So what about vitamin C and COVID-19? Research shows that there's a dramatic, rapid drop in the level of vitamin C in your blood during an infection, and in patients with acute respiratory distress syndrome or patients hospitalized with COVID-19. Their blood level of vitamin C drops to a dangerously low level, and you need it for the immune system. The level to prevent scurvy is 50, as already noted, but in the hospital, these patients, their plasma level is generally 11. That's how low it is. Not enough to activate your immune cells or to help protect your lungs and other organs during an infection. So case studies from around the world show that ill hospitalized patients with lung infections, respiratory tract infections, pneumonia, or COVID-19 are very low in vitamin C. A meta-analysis of a number of human clinical trials illustrates this. Vitamin C supplements significantly reduce the risk of pneumonia, and post-mortem studies of COVID-19 victims show a secondary pneumonia phenomenon. 62% of pneumonia patients are drastically low, not just a little low, drastically low in vitamin C. Vitamin C augments interferon production, which triggers the immune system to make cells exclusively to kill viruses. It is required by all parts of the immune system and by white blood cells and antibodies. Now, this is interesting. Vitamin C is stored in one place in the body, the adrenal glands. Well, it's 2 places, actually, the pituitary gland and the brain, but also the adrenal glands. The adrenal glands are these little triangular-shaped glands, one atop each kidney. And they do a number of things with hormones, but one of the things they do is release stress hormones. And stress hormones help block inflammation. So the amount of vitamin C in your adrenal glands is 3 to 10 times higher than you find in any other organ in the human body. And when you're infected, like with a severe virus like COVID-19, the vitamin C is released from your adrenal gland, and this results in a 5-fold increase in plasma levels. And then vitamin C then enhances the release of the stress hormone called cortisol, and this has an anti-inflammatory effect. It helps protect your cells from your immune system and from damage that could be caused by the virus growing in your lungs. So, colds are caused by over 100 different viruses from a number of different groups, including coronaviruses. There's about 5 strains of coronaviruses that cause common colds. So, if you've ever had a cold caused by coronavirus, hopefully you have a little bit of resistance to the current COVID-19 infection. That's what they're finding is a possibility. It's plausible. So, looking at colds, vitamin C reduces their duration. They last for a lot shorter a time, their severity, and the number of colds you catch. And they find that vitamin C may reduce your conversion from a mild infection to the critical phase of COVID-19. Vitamin C supplementation, as I mentioned before, reduces the length of stay in an ICU, an intensive care unit ward, if you have an infection. And it shortens the ventilation time in critical care COVID-19 patients. And it reduces, with COVID-19, the amount of time you stay in the intensive care unit. So it's not just other viruses. With vitamin C helps get you out of the intensive care unit quicker. It shortens the time you need a ventilator, if you need one. Hopefully you never will. And it reduces your risk of sepsis, where you get the severe reactions. And it reduces the need for vasopressor treatment. When you get the coronavirus, your blood pressure could drop to extremely low levels. So they give you a drug called a vasopressor to help bring your blood pressure back up to normal. So vitamin C definitely has some activity. So here's a real success story with intravenous vitamin C in a hospitalized elderly woman. She was a 74-year-old woman, and she wound up in an emergency unit in Flint, Michigan. She was suffering with a low-grade fever, a dry cough, and shortness of breath for 2 days before she was admitted. Now, here's a giveaway. Her oxygen saturation was 87. Get an oximeter. An oximeter is a little clip you put on the end of your finger, your index finger, and within seconds, you hit a button. Within seconds, it tells you the amount of oxygen in your blood, and it also tells you your pulse rate, how quickly your heart is pumping. A normal oxygen saturation in the blood is 98. If it's 87, that's putting a lot of stress on you. If it goes much lower, it can hurt your organs. It could start to damage your organs. So this lady was low in oxygen. I mean, that's a telltale sign it's coronavirus. They gave her chest x-rays, and it showed that she probably had pneumonia in her lungs. So they gave her a swab, the nasopharyngeal swab where they stick that Q-tip up your nose. And they found out she had coronavirus. They found out she had COVID-19. They also were giving her oxygen. They had to give her oxygen. On the third day in the intensive care unit, she developed mild diarrhea and generalized weakness and fatigue, but she was reporting worsening shortness of breath. Her breath was getting shorter and shorter. They had to give her more oxygen. Now, they started giving her hydroxychloroquine, which is interesting. The way hydroxychloroquine may work is it pushes zinc into your cells, and zinc helps kill viruses. So that might be the way hydroxychloroquine works, if it works at all. And they were giving her intravenous azithromycin, an antibiotic. But her shortness of breath, it's called dyspnea, was getting worse and worse. She was falling apart. It was rapidly deteriorating. Her oxygen requirements increased to 15 liters. She was drowsy. She was in distress. She was having a problem. Her blood pressure was dropping. These are all signs of like a bad infection. Her respiratory rate was speeding up to 28 breaths per minute, so she was breathing faster. So her respiratory rate had greatly sped up. They gave her a chest x-ray again, and they saw that she had the acute respiratory distress syndrome. And once again, that's when the lining of your lungs swells with fluid and it's hard to breathe. So she was deteriorating very rapidly. So they had to intubate her. They had to give her norepinephrine injection to prevent her from going into shock. They had to give her a drug called colchicine to help prevent the cytokine storm because her interleukin-6 levels were up. At the start of this podcast episode, I mentioned that interleukin-6 is released by the immune system. It's a very powerful tool of the immune system. It signals other things to happen, and it could cause extreme inflammation, and it could destroy the lungs. So they saw this. She had the pneumonia. She had the acute respiratory distress syndrome. She had elevated interleukin-6. On day 7, on mechanical ventilation, the family requested that they give her vitamin C. They gave her so they started her on a continuous and intravenous infusion of high-dose vitamin C, 11,000 milligrams every day. 2 days later, she improved dramatically. They took her off the supportive treatment. She didn't need norepinephrine anymore. On day 10, the 5th day of mechanical ventilation, another chest x-ray showed that both the pneumonia and the acute respiratory distress syndrome had improved dramatically. and she responded well to a spontaneous breathing trial. So that's an example of how important vitamin C is during the COVID-19 infection. What I'm going to have to do is stop now. This is becoming longer than I envisioned, and we'll continue this discussion on part 2 of the episode, An Important Update, Vitamin C for COVID-19. So thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or you can visit invitehealth.com/podcast. Please subscribe. Please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you another time, the next time, on the second episode of this podcast. And thank you so much for listening.